And thank you all. Hi, everyone. Thank you for joining me on World Lymphedema Day to gain a better understanding of what to expect in the course of a lymphedema treatment. A little bit about me. I graduated from Central Michigan University in May of 2021 with my doctorate in physical therapy. And I initially became interested in lymphedema treatment because of my passion for oncology rehab. Within oncology rehab, people will often end up with lymphedema due to lymph node removal, but lymphedema is much wider than that, and I've grown to love it since I received my certification for lymphedema therapy from the Norton School of Lymphatic Therapy in July of 2022. I am currently studying for my LANA certification. LANA is the Lymphology Association of North America, and they've created an exam to show that you have pursued higher education within lymphedema and shows the highest understanding of the lymphatic system. My current practice is here at Renue Physical Therapy at the McLaren Caro facility. My objectives for this presentation are as follows. I want you to have an understanding of lymphedema, its causes, and available treatments. I want you to be able to take appropriate steps prior to physical therapy so that you can make that lymphedema treatment as efficient as possible. I want you to feel confident in knowing what an eval and physical therapy treatment for lymphedema consists of, so that you can identify if you have any other diagnoses that might affect what treatment you can have. And then I want you to have awareness of the associated costs with lymphedema treatment. So to understand lymphedema therapy, I want you to have just a basic understanding of the lymphatic system. In regard to lymphedema therapy, the main function of the lymphatic system we're concerned about is the fluid transport from the interstitial space, which is just the fluid-filled space between between muscles, between cells and organs. And so the lymphatic system takes up that fluid from that space and brings it all the way back to the heart. That uptake of fluid and transport of fluid can be stimulated by muscle contraction, the arteries pulsing next to the lymphatic vessels, and breathing from within the body. And then we can also stimulate that by externally moving that fluid through manual lymph drainage, which we're going to talk a little bit more about here in a minute. So in talking about the lymphatic system again, it has 187,000 miles worth of vessels that drain from that interstitial space in smaller diameters called capillaries, all the way to the larger diameter vessels that take it all the way back to the heart. The capillaries sit right beneath the skin and are really sensitive to pressure. So these connections from the capillary to the skin will allow us from the skin level to move the skin in certain directions with certain amount of pressures to open these little gates within the capillary wall that allow the fluid and the proteins of the lymphedema to get back into the lymph system, which will then be cleaned up and taken back to the heart. So then you can also think of the lymph system as kind of like a sewer system. So those capillaries at the skin level are like this, like the sink drains, the bath drains, washer drains that take all the water from your house that's all used up. And then it goes into this main pipe for the house all the way out to the sewer system. And then you have the sewer system within the street that takes all of the water from the houses across your whole block, your whole street, your whole city, all the way back up to the water treatment. As you can see in this picture, there's different areas within the body. So you can see these dashed lines here called watersheds. So typically we have fluid flow that goes in a particular direction within one area. However, when there's some sort of issue with the lymphatic system, whether that be lymph node removal, some sort of trauma to the system, or something else going on, we can use these little connections here that are like fluid highways between cities. So when, say, we have an area here in the armpit that's not working really well, we can't push fluid from the fingers into that armpit area. We have to use different areas. So maybe we come around to the front and use the same side leg, or we go around the back and use the other arm to try to help move that fluid a little bit better. So we'll get a little bit more into that here in a second. So what is lymphedema anyways? So lymphedema itself is a protein-rich edema that collects in that interstitial space within any given body part. Most commonly, it's going to be within an arm or a leg, but you can also get it within the genitals, head, and trunk. So sometimes that swelling is visible and sometimes it's not visible, just depending on the stage of the lymphedema. In general, lymphedema is caused by either a mechanical or a functional deficit of the lymphatic system. So there's missing or broken parts within the lymphatic system. The lymphatic system isn't performing well enough, or it's being completely overloaded by some other system. The primary causes are those that we don't really know why they happen. So either someone can be born without part of their lymphatic system. As somebody grows through puberty, the lymphatic system doesn't keep up and you start to notice some of that lymphedema. Usually it's something that they're born with or some sort of genetic disposition to the lymphedema. So then there's also secondary causes, which most people are more familiar with. Those are known causes of damage to the lymphatic system. So those can be tropical parasites, radiation therapy from cancer, where it causes that really hardness of the skin and lymphatic system. Then there's surgical removal of the lymph nodes, chronic venous insufficiency, trauma to an extremity, repeated infections, or even obesity. So the treatments that have been historically and are currently available can include elevation of that limb that's affected by the swelling, drugs such as diuretics, a common one would be Lasix, garments that add pressure to that limb, pneumatic compression pumps, which are like long gloves or socks that you put on and it attaches to a machine and causes it's kind of like a really big blood pressure cuff that pushes fluid from the toes up to the heart or the fingers up back to the heart. There are surgical procedures that have been done in liposuction. So some of these can be really good in addition to physical therapy, but none of these will manage lymphedema alone because of that protein richness within the lymphedema, which again, we'll talk about here in a little bit. The gold standard treatment for lymphedema is complete decongestive therapy, which is what we do within the physical therapy setting. And we're going to get into a little bit more details after we finish talking about what lymphedema is. So these are the stages that I was talking about a moment ago of lymphedema diagnosis. So lymphedema itself is often diagnosed by exclusion of other conditions, by taking a medical history, and by physical exam of the swelling, so measurements and seeing if when we push into it, if fingerprints are left. So there are some imaging that are available, but that requires that some sort of dye be injected into the area so that on the camera we can watch if the lymphatic system is taking up some of that extra fluid and if it's traveling all the way through well, or if there's any hiccups anywhere. The problem with that is that if there is damage to the skin or the lymphatic system by the injection or by a reaction to the injection, that can either worsen lymphedema or it can cause lymphedema if you didn't have it to begin with. And that's not something we want to do. So most often those imaging techniques are left for research purposes. Very rarely are they used for actual diagnosis. So then when we go into each of these stages, the latency stage, you can see that there's no visible or palpable edema. So that means when I look at you, your legs might look pretty similar, but when you're moving throughout your day, you'll notice that that arm or that leg becomes really heavy to move. Something about it just feels off. And a lot of times these are people that have already had histories of some sort of surgery or trauma. For instance, if somebody's had a mastectomy on the left side and then 3 months down the line, their left arm starts to get really, really heavy. If they had lymph node removal during that mastectomy, then it's likely that they're having the beginnings of lymphedema. And so then we look at stage one. Sometimes stage one is reversible. So this is where you can visibly see that there is swelling within the arm or the leg. But when you put it up above the heart, that edema, that swelling will go down. Sometimes you'll also have where we start to notice that pitting. So that's where I reference, if I were to gently push into the arm or leg where the swelling is present, the fingerprint would actually stay there. Depending on how bad or how severe it is, that fingerprint will stay there for various amounts of time. When you go into stage two, that stage is spontaneously irreversible, meaning that we're probably not going to get all the swelling to go away, and stay away. It's going to take a long-term management of the condition. The pitting becomes more difficult, meaning that when I push into that swelling, I have to push with a little bit more force in order to get that fingerprint to show up within the swelling. This is also where we'll start to get fibrosis of the skin. Because of the high protein of the fluid in lymphedema, the protein causes the skin to get really hard and difficult to move, which then further affects how well the lymphatic system can work. Once you get to stage 3, this is where the edema is no longer pitting. You can't push hard enough to get that fingerprint to stay. There's definite hardening of the skin that may or may not be reversible. And you'll start to notice a lot of those skin changes with papillomas, skin tag looking changes, different color changes potentially within skin folds. So all of this can be helped within the complete decongestive therapy, but at various intensities of treatment. So you got your diagnosis of lymphedema, so what next? So at that point, you're going to have to get a prescription for lymphedema physical therapy so that we can begin to set up your evaluation with us. That prescription can be from your primary care physician, but it can also be from a specialist that you see. If you get the primary care physician to sign off on physical therapy, we may still need additional clearances from other specialists, whether it be a kidney specialist, a cardiologist, or a vein specialist that you're seeing. And that's because we're going to end up moving a lot of fluid. And so if you're already having to see some sort of specialist, we want to make sure that we're not interfering with anything that they're already doing. If that prescription gets faxed directly to the physical therapy office, we'll call you, set up schedule you an appointment as soon as possible, and give you any additional information you need from there. Between that time and the time that you come in for physical therapy, you want to maintain good skin hygiene, which means making sure that the skin is completely clean within the folds and hard to reach areas, drying the skin thoroughly to make sure that no moisture is sitting there and allowing for infection to come in, and hydrating with a good lotion that's non-scented, that hopefully won't cause any skin irritation, such as non-scented Eucerin. This is going to help. The good skin hygiene is going to help to make sure that when you come in, hopefully we have avoided any complications between the time that you've seen the doctor and the time that you come in to see me. That way we can begin therapy as efficiently as possible. When you come in for evaluation day, it starts out with your typical medical forms, making sure that we have a complete history of your condition and your other medical history. Then when you come back, we're going to discuss all of your history with lymphedema and your medical history, any previous treatments, any medications that you're on, any blood or lab work that you're getting done to monitor other conditions, because we may have to get in touch with those other doctors, like I mentioned, to make sure that they don't want to increase any frequency that you have to get that done. Then we go through and identify any social support you have, whether it's from family, friends, church, the community. We want to make sure that you have help with this, because this compression therapy, which I'll show you, is going to get a little bit cumbersome in some areas. And so the way that we wrap you, the types of compression we use may change depending on that social support that you have available to you. Then we also want to talk about the effect of lymphedema on your quality of life. Are you able to get to your doctor's appointments easily? Are you able to go out with friends when you want to go out? Do you potentially shy away from going out with friends because you're embarrassed about how your arm or your leg looks, or having to wear a compression garment? So we talk about all of that as well. When we get into the measurements, you might need some help. That could be from me, or if you're more comfortable bringing somebody with you that you're familiar with. We get down to skin level. So whether that be undergarments or no bra, we have to be able to assess the skin and move pretty easily, and we don't want clothes restricting that. So we'll get a weight to make sure that's going to give us a baseline of how much fluid we're losing between sessions. We have to get a circumference of the leg or arm affected. And if it's the arm, we go all the way from the fingers up to the armpit. If it's the leg, we go from the toes all the way up to the groin and hip area. We take measurements every 4 centimeters so that we can really closely monitor where the changes are happening as we go through therapy. We'll also get an idea of what your general strength looks like, your range of motion available to you, and your overall functional mobility. How well can you move in bed? How well can you stand up from bed? How well can you get from your bedroom to your bathroom, to your kitchen, meal prep? Then we go into a wound assessment if needed. So if you already have wounds present within the legs or arms, legs more commonly, we'll take measurements of how big that wound is, if there's any skin changes around there, potential infection, and then we address that as needed with a specialist. At that point, we take all that information and we discuss what your specific plan is going to be and what the goals that you want to achieve within therapy are. And we'll talk about what might be realistic and where we can achieve that in how much time. So this is what therapy is broken up into two phases. We have the phase 1 decongestion and phase 2 maintenance. So you'll see some overlap. The main difference between these two phases is in that phase 1, we're really going intensely at trying to get some of this fluid reduction. And a lot of the work is being done by myself, the therapist. So we go through the skin and wound care as needed, making sure that the skin is clean and hydrated. We go into that manual lymphatic drainage, which basically feels like a massage to you, where we go in very specific directions of movement, very light pressure. Most of the time it feels like a pain relief for you guys when you're going through that. And we start all the way up at the neck, go through the abdomen, and then we go down from the arm closest to the heart, away from the heart, and then all the way back up. We have to clear the traffic closest to the heart where everything is kind of clogged up. And then we go in and move some of that fluid that's stuck within the arm or the leg. Then we go, after we move some of that fluid, we then use a compression garment or a wrap that helps to contain some of that fluid. Then we go into some exercise, and I'll explain a little bit more about why we do exercise and how we do it safely in a little bit. As we get towards the end of your therapy within that decongestive phase, we start transitioning some of this stuff to either yourself or a caregiver. And we go through how you can do these types of things on your own at home. And we specifically choose different compression garments that will work for you and that you can manage on your own or with help of somebody that you live with. So this will start to begin close to the end of therapy, and then you transition maintenance phase on your own. So the complete decongestive therapy, those two parts that happen within a session that everyone's curious about, is the manual lymph drainage. The length of time that we do this is dependent on the number of limbs affected and any other comorbidities you might have. So if we have 2 legs affected, it's going to take a little bit longer for us to go through that than if you have only 1 leg affected. And a leg usually takes a little bit longer than having to work an arm because the arm is a little bit smaller. So that'll be dependent. The entire lymph system, like I mentioned, has to be stimulated. We have to go from the neck and the abdomen all the way out to the end of the leg or arm, and then all the way back. So usually about 45 minutes minimum for that. Then we use that lymphatic system as a highway that we talked about earlier to get that congestion all the way out from the farthest part of the body to the closest part of the body. And the nice thing about the manual lymph drainage is when I mentioned that the lymphedema is a high protein fluid, that's important when it comes to the skin fibrosis. So that skin hardening, if the protein just sits there and we just remove fluid and we don't remove the protein, the skin just gets harder. And a lot of those other alternative therapies or treatments that I talked about address the fluid, but they don't address the protein, such as those pneumatic compression pumps. It can help to reduce the fluid, but it doesn't get the specificness of what we do with the manual lymph drainage to be able to get some of that protein movement as well. The compression therapy that we use is a combination of different things depending on your specific condition and how you present. So we use short stretch bandages, which are kind of look like ACE bandages, but they're different in how they apply pressure. We use foam within that bandage to make sure that we take up some space. And that can also help to soften the fibrotic tissue or that hardened tissue. The short stretch bandages have a high working pressure and a low resting pressure. So if you've ever taken an ACE bandage and tried to wrap your legs to get some reduction or your arm, you might have experienced a tourniquet where it finds different folds or it just gets really, really tight and it feels like it's cutting off circulation. The reason for that is because the ACE or long stretch bandages have a high resting pressure. And so when you're just sitting there doing nothing or watching TV or whenever you're resting, that bandage is applying a lot of pressure. The difference of the short stretch bandage is just the opposite. So the only time it's providing that high pressure is when you're working or exercising. And then it has a low resting pressure to avoid it digging in on some of those different areas of the skin. The foam, like I said, takes up space between that short stretch bandage and the skin. So as you exercise or walk, you will hopefully continue to decongest while you're in this bandage. So the foam will continue to expand to make sure that you don't expand, the leg doesn't come back, the fluid doesn't come back while in between sessions. So this is a picture of some of the compression supplies that we would use. You have in the back here the gray foam. We cut that, it comes in sheets and we cut that specifically to your leg or your arm so that it's a direct fit for you. It should move with you as you go through the day. And as your leg decongests or your arm decongests, we will trim that foam so that it continues to fit you. We have some of that Eucerin lotion that we were talking about. This is like a gauze that we fold and use for the fingers and toes, but it still allows you to have some grip. So when you're walking, you don't trip and fall or slip. And then when you're trying to grab things with your hands, you can still grab it without it slipping out of your hands. These two are different size cottons they provide some barrier between the foam and your skin so that it doesn't get so irritated, especially areas like behind the knee and the nook of the elbow. This little green kidney bean looking thing here is a complex foam. So that's a little bit thicker than the gray foam, a little bit more aggressive. So we can use pieces of this in areas of really hard tissue to try to break that up. And we can also use that in areas that need to be carved out a little more, like the back of the hand, the back of the foot, and the ankle area. Swelling likes to sit there because it goes the path of least resistance. Then you have your various sizes short stretch bandages. We have smaller ones for the hand. We're not going to want to use the same size bandage we use on the hand as we use on the thigh. So different bandages for different strength. They're different size areas. We apply these bandages in a way that is in a gradient. So we apply the most pressure towards the toes and the hand, and then the least amount of pressure as we get up to the thigh. And it's not necessarily that we're pulling it so tight that it's going to cause that cutoff in blood flow. We're just using different techniques of bandaging, different patterns, so that we can get some overlap in the bandaging. As we have more layers, there's more compression. So I have a video here, it's 8 minutes long. We're not going to watch the whole thing, but it gives you an idea of what the bandaging might look like within therapy when we're in that decongestive phase. And we're going to skip through pieces of it here as we go through. So she started out having already cleaned and hydrated the skin with lotion, and she applied a stockinette just to help prevent that foam from irritating different areas of the skin. Then she's going to start with that cotton-like or gauze-like bandaging to help wrap the toes to prevent swelling from being pushed out into the toes. And as you can see, she's not pulling really hard. We're just gently layering it to prevent swelling from going there. And she'll wrap each individual toe there, leaving the toe pad open so that you still have some grip while you're walking. She's still going through the toes there. Then she's taking some of that cotton and protecting different bony areas that are susceptible to wounds. So like the tops of the feet, the ankles, And then she'll eventually wrap the back of the knee as well, just to make sure that we're not causing any wounds. And she's had some extra, so she just continued wrapping it around. She's already cut the gray foam specifically to her person that she has sitting there. And you can see there's different cuts to avoid it digging in on the back of the knee there and the top of the foot at the bottom. Then she just uses a gentle gauze with no pressure just to hold that foam in place. Some more cotton to protect the foot from the foam. And holding that in place. Then she's going to start applying some of those short stretch bandages all the way from the toes up to the knee. And you can see the multiple layers there so that we make sure we have more pressure at the toes and bottom of the foot. And we'll click through the rest here. You'll just see that there's different patterns that are used as she continues to go up the leg to make sure that we get a good amount of pressure without having to pull and cut off blood supply. So this here is just a spiral all the way up the leg. So now she, in this demonstration, only went up to the knee, and depending on what we find in the assessment would determine how far up the leg we go. In a lot of cases, we go all the way from the foot up to the hip, and that bandage is then worn for about 23 hours a day, only taken off for the part of before you come to therapy for that cleaning and hydration. And then when we do the actual therapy, it's not on with the massage. So that was like kind of like the traditional gold standard treatment. So as you can imagine, that's pretty hard to do just on your own if you don't have somebody helping you. So now they have a lot of these alternative type dressings that use Velcro and come with this little chip that sits there on the top and shows you how much overlap you should have to make sure that you're getting the right amount of pressure. So I just want to show you what some of these look like. So this would be like a full leg. The problem that we run into with these is that they can be a little bit pricey. So for instance, on this website, this is kind of like a online medical supply store. But as you can see, this whole leg ends up running about $400, and that's just for one leg. And there's lots of different options for just part of the leg. That's all stuff that we discuss. Then you have the arm ones. This is a different brand, a different manufacturer, but this whole arm reduction kit would run about $187. And that's if we didn't need to get any other things for the fingers as well. So lots of different options available now that we could easily discuss what might be appropriate for your case. Then we go into compression for the maintenance phase. So those bandages aren't something that you have to do the rest of your life, but once we get into that maintenance phase, we have a different goal. The goal isn't to continue reducing, it's just to keep the limb where it's at and not allow it to get any more fluid in there. So there's different types of knits, and all that really means for right now that you need to understand is that it depends on where the seam is, and it also gives you different amounts of pressure. So for instance, a circular niche, that one we might use for a less or a lower stage lymphedema that doesn't have any skin folds. The flat knit is a little bit safer for anybody that has skin folds because it doesn't find those areas and just dig in where the circular knit might. Then we also have to consider night versus day options. And there's a lot of customizations available now. So there's lots of different patterns, lots of different colors, how high they go, lots of different things. The night ones are kind of nice because they actually have a cooling fabric, and they have it feels almost like a memory foam within there. So it's really soft, easy to sleep in, especially when they can get pretty warm when you're wearing them. I think I have that. So yeah, so that would be then we have exercise. So a lot of times I get the question of, is exercise really safe for lymphedema? And a lot of research out there is now saying that it's actually going to continue to help decongest the leg when you're in those compression garments. So when the bandage is on, the short stretch bandages, we're in the intensive phase, it's going to help. I mentioned at the very beginning where that muscle contraction is going to help really push some of that fluid out. And so the exercise is an important piece. It doesn't mean we're going to have you walking on a treadmill for 20 minutes. We individualize it to wherever you're at. So it may be just trying to get some range of motion where we just bend and flex the wrist, bending and extending the elbow, just trying to get some repetitive motion so that we can help stimulate the lymphatic system a little bit better and continue to improve reduction of the limb while we're in that intense phase. And even in the maintenance phase, it's not dangerous. When we look at some of those secondary causes of lymphedema, one of them can be obesity. And so you want to make sure that we manage all of it. Everything is a balance. And that's why it's all very individualized to meet you wherever you're at when we evaluate you. So the overall goals of complete decongestive therapy, we want to reduce your risk. So for instance, if somebody you know or you yourself know that you're going to be having a mastectomy due to breast cancer and there's lymph node involvement and you're going to have some of those removed. At that time, we can have a discussion about what you can do to limit your chances of developing lymphedema. That can include using sunscreen when you're out in the sun. It can include using bug spray to avoid any sort of bug bites, avoiding blood pressure cuff readings that are over and over and over on that side. Really just avoiding any sort of injury to the arm or getting injections on that side so that we can help keep the lymphatic system as safe and efficient as possible without those lymph nodes there. We want to intervene as early as possible. When we were talking about those stages earlier, we talked about the latency stage where you may not notice a ton of lymphedema or swelling when you look at somebody. Then we talked about how that stage 1 is a reversible stage. Stage 2 is spontaneously irreversible. And so as you get later and later down the line of lymphedema, it's less likely that we can get complete results, and it becomes a long-term management condition. We want to get that volume reduction and get as much fluid and protein off of the limb as possible, especially within that intensive phase. We want to help to manage infections. One, catching infections as they happen, or as we notice wounds developing in different areas, but also as we have that lymphatic fluid just sitting there in the skin, it can reduce the amount of healing that's occurring. And so it prolongs how long a wound will sit there. And that puts you at risk for a lot of chances for infection to get into those wounds. So we want to address that as quickly as possible. The fibrosis management of the skin. So getting the skin to move manually through that massage manual lymph drainage, and then using some of those foams to be a little bit more aggressive about it and get that skin a little bit more mobile. We want to improve your functional goals. So those being able to move around in bed, sitting from standing, standing from sitting, being able to go to church once you get that functional improvement. And that leads into that psychosocial improvement where you're not as afraid to hang out with your friends and family. You have an easier time getting to and from your doctor's appointments. And that comes with some of that exercise as well, where we improve your strength. So when we're developing your plan of care on that evaluation day, there's lots of things we have to consider. So this was your overall general what to expect from lymphedema therapy, but these are some of those specifics that can change it, among others. This isn't an extensive list, but if you have those other diagnoses, again, we might have to clear some other problems with your doctors first to make sure that you're safe for participation within this therapy. And then we might have to adjust how we do compression. So for instance, I mentioned in the video that she only went up to the knee. Sometimes that's appropriate if we don't want to move a ton of fluid all at once because we need to be cognizant or aware of your kidney function. So we make specific changes based on any other diagnoses that you have. Wound care. So if you currently have an infection or you start to develop an infection within the time that you're in therapy, we may have to hold off because if we're moving this fluid through the system, we can easily spread infection, and that's not something we want to do. If there's no infection within the wound, we can actually help improve wound care by getting some of this fluid off of there, but we might have to coordinate with that wound doctor that you're seeing to make sure that we have appropriate bandages and somebody is aware of how to apply those bandages and treatments. Limb paralysis, this comes into effect when we're talking about the compression as well, because if the compression is too tight and you can't feel your arm, we might have to make adjustments on how tight that bandage is, and you might not be aware of it, putting you at risk for some of the wounds at those bony areas that we talked about. We try to avoid that as much as possible. We just might use a little bit lighter pressure to begin with to make sure you tolerate it okay. Lymphedema is something similar that is commonly mistaken for lymphedema at first glance. So it's a consideration because you might not need as much of the decongestive therapy as somebody with lymphedema. Lymphedema is more of a adipose condition where the body just lays down fat tissue in certain areas of the body and pulls on the connective tissue, causing a lot of pain. So this type of therapy is still effective, but it's a slightly different treatment that we would have to consider. The stage of your lymphedema will affect how aggressive we can or have to be with some of the foam and some of the compression therapy. If there's any genital head or trunk edema, we have to address that as well, and that'll change how we can apply compression, where we have to apply compression, and how we do our lymphatic massage. Insurance coverage and other expenses are something that we'll have a discussion about to make sure that you're fully aware of everything up front, and that we can identify different support systems if need be. And then that social support will affect what kind of things are recommended for the compression therapy, whether we go with that traditional or alternative type therapy with the Velcro. So what are the expenses? We have the physical therapy copays or coinsurance. So if your insurance tells you that you have a $40 copay every time you come in, then you would have that $40 copay. The decongestive phase garment. So McLaren currently provides those traditional materials required for that decongestive intensive phase. A lot of places don't cover that part, so that's a huge expense that's taken off. If you want any of those alternative garments for the intensive phase, however, like the Velcro ones, that would be an expense that comes out of your pocket. And then the maintenance phase garments are an expense to you. So both the night and the day versions, and those are custom made. So those tend to run a little bit more expensive, around, I've seen a leg compression therapy run about $600 for. So some good news in regards to expenses is that the Lymphedema Treatment Act just passed in December of 2022 through Congress and will take effect in 2024. And this is in general going to help improve insurance coverage for those compression supplies, which are really important for treatment intensively and maintenance. Renue has currently 16 locations, as you can see on the screen. As of right now, lymphedema therapy is only offered at the Caro location. And I'd be happy to take any questions that anybody has at this point.
Thanks, Megan. Unless anybody has any last minute questions, I didn't see any come through. But thank you so much for sharing all this wonderful information. It was very, very helpful, and I'm sure you're going to help a lot of people get the help that they need. So
I was happy to be here.
sounds good. Thank you, Megan.
Thank you. Thank you, everybody, for joining us. And hopefully you have a little bit better understanding of what lymphedema therapy looks like. At the end here, there is my contact information. If you think of anything along the way, or you're interested in coming to see me to receive treatment. So thank you, everybody.
Wonderful. Thank you.